Anemia is a common blood condition that affects millions of people worldwide. It occurs when your body doesn't have enough healthy red blood cells to carry adequate oxygen to your tissues. This can lead to a variety of symptoms and health issues. It means your body doesn't have enough healthy red blood cells, which are crucial for transporting oxygen from your lungs to the rest of your body. Without enough red blood cells, your organs and tissues don't get the oxygen they need to function properly. Red blood cells are important because they carry oxygen throughout your body. They pick up oxygen in the lungs and deliver it to cells all over the body, ensuring that your muscles, brain, and other organs work efficiently. When you have anemia, your body doesn't get enough oxygen. This lack of oxygen can cause a range of symptoms including shortness of breath, dizziness, and headaches. You might find it difficult to perform everyday activities that you once did with ease. This can make you feel tired and weak. Fatigue is one of the most common symptoms of anemia, and it can be debilitating. You might feel exhausted even after a full night's sleep, and simple tasks can leave you feeling drained. Anemia can affect people of all ages. From young children to the elderly, no one is immune. It can be particularly concerning in children and pregnant women, as it can impact growth and development as well as pregnancy outcomes. It is a global health concern. In many parts of the world, anemia is a major public health issue, often linked to poor nutrition, infectious diseases, and chronic conditions. Efforts to combat anemia are ongoing, with many organizations working to improve diagnosis and treatment. Millions of people around the world have anemia. It is estimated that over 1.6 billion people are affected by this condition, making it one of the most common blood disorders. The prevalence of anemia varies by region, age, and gender. Anemia can significantly impact a person's quality of life. It can affect your ability to work, study, and enjoy leisure activities. Chronic fatigue and weakness can lead to feelings of frustration and depression, further affecting your overall well-being. There are many different types of anemia. Some of the most common types include iron-deficiency anemia, vitamin B12 deficiency anemia, and anemia of chronic disease. Each type has unique causes, symptoms, and treatment options. Each type has its own causes and treatments. For example, iron-deficiency anemia is often treated with dietary changes and iron supplements, while vitamin B12 deficiency anemia may require B12 injections or oral supplements. It's important to identify the specific type of anemia to determine the most effective treatment. It is important to see a doctor if you think you may have anemia. A healthcare professional can perform tests to diagnose anemia and identify its cause. Early diagnosis and treatment can help prevent complications and improve your quality of life. Treatment for anemia can help you feel better and prevent serious health problems. With the right treatment plan, many people with anemia can manage their symptoms and lead healthy, active lives. Don't hesitate to seek medical advice if you suspect you have anemia. There are many types of anemia, each with its own causes, symptoms, and treatments. Understanding the different types can help in managing and treating this condition effectively. Here are a few common ones that you should be aware of. Iron deficiency anemia. This is the most common type of anemia. It happens when your body doesn't have enough iron. Iron is needed to make hemoglobin, a protein in red blood cells that carries oxygen. Without sufficient iron, your body can't produce enough hemoglobin, leading to fatigue, weakness, and shortness of breath. This type of anemia can often be treated with dietary changes and iron supplements. Vitamin deficiency anemia. This type of anemia is caused by a lack of vitamin B12 or folate. These vitamins are also needed to make healthy red blood cells. A deficiency in these vitamins can lead to the production of abnormally large red blood cells that don't function properly. Symptoms may include fatigue, dizziness, and pale or yellowish skin. Treatment typically involves dietary changes and vitamin supplements. Anemia of chronic disease. This type of anemia can develop as a result of other medical conditions such as cancer, kidney disease, or rheumatoid arthritis. These conditions can interfere with the production of red blood cells, leading to anemia. Managing the underlying condition is often the key to treating this type of anemia. Aplastic anemia. This is a rare but serious type of anemia. It occurs when your bone marrow doesn't make enough red blood cells. This can be due to damage to the bone marrow from factors like radiation, chemotherapy, or certain infections. Symptoms can include fatigue, frequent infections, and uncontrolled bleeding. Treatment may involve medications, blood transfusions, or a bone marrow transplant. Hemolytic anemia. In this type of anemia, red blood cells are destroyed faster than the body can replace them. This can be due to autoimmune diseases, certain medications, or inherited conditions. Symptoms may include fatigue, shortness of breath, and jaundice. Treatment depends on the underlying cause and may include medications, blood transfusions, or surgery. Sickle cell anemia. This is an inherited blood disorder. It causes red blood cells to become misshapen and break down. These misshapen cells can block blood flow, leading to pain and organ damage. Symptoms can include severe pain, frequent infections, and delayed growth. Treatment may involve pain management, blood transfusions, and medications to reduce complications. Thalassemia. This is another inherited blood disorder. It affects the body's ability to produce hemoglobin. There are different types of thalassemia, ranging from mild to severe. Symptoms can include fatigue, weakness, and bone deformities. Treatment may involve regular blood transfusions, medications, and sometimes a bone marrow transplant. Understanding these different types of anemia can help in seeking appropriate medical care and managing the condition effectively. Anemia happens when your body doesn't have enough healthy red blood cells. These cells are crucial because they carry oxygen from your lungs to the rest of your body. Without enough of them, your organs and tissues can't get the oxygen they need to function properly. This can happen for a few reasons. Understanding these reasons can help in diagnosing and treating anemia effectively. One reason is that you might not be making enough red blood cells. This is often due to deficiencies in essential nutrients. This could be because you're not getting enough iron, vitamin B12, or folate in your diet. These nutrients are vital for the production of red blood cells. Iron is a key component of hemoglobin, the protein in red blood cells that carries oxygen. Vitamin B12 and folate are necessary for the production and maturation of red blood cells. Or it could be because you have a medical condition that affects your body's ability to make red blood cells. Conditions like chronic kidney disease or bone marrow disorders can interfere with red blood cell production. Another reason for anemia is that you might be losing red blood cells too quickly. This can be due to various factors including chronic bleeding. This can happen if you have a bleeding disorder or if you're taking certain medications. Some medications can cause gastrointestinal bleeding or interfere with the production of red blood cells. Sometimes anemia is caused by a combination of factors. For instance, you might have a condition that both reduces red blood cell production and increases red blood cell loss. For example, you might have a medical condition that makes it harder for your body to absorb iron from food. Conditions like celiac disease or Crohn's disease can damage the intestines, reducing their ability to absorb nutrients, including iron. This can lead to chronic anemia if not properly managed. Section 4. Who is at risk for anemia? Anyone can develop anemia, but some people are at higher risk than others. You may be at increased risk of anemia if you don't eat a healthy diet, have a heavy menstrual period, are pregnant, have a chronic disease such as cancer, kidney disease, or rheumatoid arthritis, have a family history of anemia, or are over the age of 65. If you are at risk for anemia, talk to your doctor. Section 5. Diagnosing anemia. If you think you might have anemia, it's important to see your doctor. They will ask about your symptoms and medical history, and they will also do a physical exam. To diagnose anemia, your doctor will order a blood test called a complete blood count, or CBC. This test measures the number of red blood cells, white blood cells, and platelets in your blood. It also measures the amount of hemoglobin in your blood. Based on the results of your CBC, your doctor may order other tests to determine the cause of your anemia. These tests might include iron studies, vitamin B12 level, and folate level. Section 6. Preventing anemia. You can lower your risk of developing anemia by eating a healthy diet that is rich in iron, vitamin B12, and folate. Good sources of iron include red meat, fish, beans, lentils, spinach, and iron-fortified cereals. Good sources of vitamin B12 include meat, poultry, fish, eggs, and dairy products. Good sources of folate include leafy green vegetables, citrus fruits, beans, and lentils. If you are pregnant or planning to become pregnant, talk to your doctor about taking a prenatal vitamin that contains iron and folate. Section 7. Conclusion. Anemia is a common blood condition that can cause fatigue, weakness, and other symptoms. There are many types of anemia, each with its own causes and treatment. Early detection is important. If you think you might have anemia, talk to your doctor. They can do a blood test to check your red blood cell count. Anemia can often be prevented with a healthy diet rich in iron, vitamin B12, and folate.